Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hi, I am Dr. Bhargaw Ilapakurthy, ENT and head and neck cancer surgeon from Hallmark ENT and Gastro Clinics, Manikonda, Hyderabad. Common myths about vertigo. Bursting the everyday misconception people believe about vertigo. We have covered a lot in this series, but even after people finally getting a diagnosis, many are still carrying beliefs about vertigo that simply aren't true. And those myths matter. They delay treatment, they discourage recovery, and they make an already difficult experience even harder. So, today, for our final episodes, we are clearing the air. The most common myths and what are the evidences actually say. Welcome to Study Balance. This is episode 16. Let's start with one of the biggest misconceptions. Vertigo is not the same as general dizziness. In medical terms, vertigo means a false sensation of movement, usually spinning, tilting, or shifting when you're actually still. Why does this matter? Because how you describe your symptoms shapes the diagnosis. Saying, I feel dizzy is vague, but saying, I feel spinning when I roll over in bed can immediately point towards PPPV, the most common vestibular cause of vertigo. Another common myth, vertigo is a fear of heights. It isn't. Fear of height is called acrophobia, a psychological response. Vertigo, on the other hand, is a medical symptom related to balance system dysfunction. The confusion comes from everyday language, but medically, these are completely different things. This is one of the most harmful myths. There is no treatment. You just live with it because it stops people from seeking help. The truth is, many forms of vertigo are treatable. For example, BPPV can be often be treated with repositioning maneuvers like Eplise. Vestibular rehabilitation has strong evidences for improving balance and reducing symptoms. Vestibular migraine can be diagnosed and managed with targeted treatment. Even conditions like Meniere's disease, while not curable, are still manageable. So, the real issue isn't that nothing can be done. It's that the right diagnosis leads to the right treatment. When vertigo hits, resting feels natural, and during severe episodes, it can help. But long term bed rest, that can actually slow recovery. The brain adapts to vestibular problem through movement and recalibration. Avoiding movements for too long prevents this adaptation. That's why vestibular rehabilitation works. It uses controlled, gradual movement to retain the brain. And in some cases, prolonged avoidance can contribute to conditions like PPPD, where dizziness persists due to heightened sensitivity and behavioral pattern. Another myth, vertigo means something is seriously wrong with the brain. This fear is very common and understandable, but here is the reality. Most vertigo is peripheral, meaning it comes from the inner ear, not the brain. Conditions like BPPV, Meniere's disease, and vestibular neuritis can feel severe, but they are not usually life threatening. Yes, central causes like stroke do exist, but they are far less common. The key is not to assume the worst, but to get a proper evaluation. This is the most frustrating myth for patients, which states that if tests are normal, nothing is wrong. Normal tests do not always mean there is no problem. Some vestibular conditions are diagnosed clinically, especially when symptoms come and go. For example, vestibular migraine, PPPD, episodic conditions like BPPV, or Meniere's disease. These may all show normal test results between episodes. So, if your symptoms are real and persistent, normal tests are just one part of the picture, not the final answer. Let's close the series. Three key takeaways. 1. Learn to describe your symptoms clearly. Good language leads to better diagnosis. 2. Treatments exist for many vestibular conditions, but it starts with the right diagnosis. 3. Recovery is possible with the right approach. Most people can see meaningful improvement in their quality of life. And that's the Vertigo series. If you have been listening as a patient, a caregiver, or a clinician, thank you. If this series helped you or someone you care about, share it. That's how the right information reaches the people who read it most. Take care of yourselves.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.